Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. Today we are going to learn something about blood thinners. So let's begin. What are blood thinners? Why do we need blood thinners? When you accidentally stick a pin into your fingertip, blood comes out. And within a few seconds, the body begins to form a clot to prevent you from bleeding excessively. How does the body form a blood clot? Okay, here is another example of how a body forms a blood clot within a blood vessel. This is a normal blood vessel applying the heart muscle, and over a period of 30-40 years, a plaque builds up, and when this plaque reduces the lumen to about 95%, because of the sluggish blood flow and trauma resulting on the lining of the wall, leads to blood clot formation. On one hand, we have blood clotting inside the body, and on the other hand, we have bleeding when we get trauma to the body externally. Both blood clotting and bleeding are like two phases of a coin. We need a very delicate balance between blood clotting and bleeding, so that on one hand, you want your body to clot the blood when it is necessary, like if you bruise your knee and you're bleeding, and you definitely want to stop the bleeding in the knee. On the other hand, you don't want blood clots to be forming inside your body, like getting blood clots in the legs or getting blood clots in the heart, which can cause stroke, getting blood clots in the blood vessels supplying your heart that can cause a heart attack. How do we bring about this delicate balance? If there is excessive blood clotting inside the body, we use blood thinners. If there is bleeding outside, the body automatically has chemicals that can form a blood clot, thus preventing you from bleeding excessively. So we need to understand there are two mechanisms going on inside or outside the body. One is the coagulation pathway, that is the clotting pathway, and on the other side we have a clot breakdown pathway, so that there is a delicate balance. In fact, within our own body, there is continuous trauma to the tissues which causes blood coagulation or clotting. At the same time, there are agents which break down these small clots during the process of repair, because you don't want the clot to be sitting there in the body, which serves no purpose. So let's look at this coagulation cascade and the clot breakdown pathway. Whether the trauma happens outside the body, like when you fall down from a bicycle, or if the trauma occurs inside a blood vessels because of plaque building, plaque rupture, something like that, it sets off a series of chemical reactions. And these chemical reactions go through, one activates the next one activates like factor 12 activates factor 11, factor 9, and this one activates factor 10, and then factor 10A, and they work on what is known as prothrombin, which is converted into thrombin, and this thrombin acts on fibrinogen and it converts it into fibrin. Fibrin is a little wire mesh that is created at the site of a wound. And in this wire mesh, these small little cells known as the platelets get stuck together. As a result, this wire mesh of fibrin and platelet becomes the clot. It forms like a mass which prevents further bleeding. So that is the clot formation. And I want you to remember this: platelets and fibrinogen and thrombin, because we are going to come back to those terms. And on the other hand, when minor blood clots are formed within the body, like in the legs or anywhere else, the body has other chemicals known as plasminogen activator, which activates the plasminogen, and that plasminogen dissolves these fibrin strands and breaks down this clot during the healing process. If the body already has a mechanism to clot, and if the body already has a mechanism to break down the clot, why do we need blood thinners? And where do we need blood thinners? Okay, first let's talk about commonly used blood thinners, aspirin and Plavix. They act on the little platelets, which I just showed you a minute ago. They most commonly use blood thinners such as warfarin or coumadin, Xeralto, and Eliquis. They act on that little coagulation cascade which I showed you. Remember, I was talking about factor 10, 10A, and in fact, coumadin acts on multiple factors as opposed to Xeralto and Eliquis, which acts on factor 10A. But that's not important. What is more important is for you to understand when you need a blood thinner and how much blood thinner you need. Aspirin is a pretty weak blood thinner. Nonetheless, when aspirin acts on the platelets, its action is permanent and you cannot reverse the action. Same thing with the Plavix. That's why when you have to go for surgery or procedures, you have to stop your aspirin and Plavix for 4 to 5 days before you go for any surgery or procedure. Similarly, with coumadin, Xeralto, and Eliquis, you have to stop them for at least 4 to 5 days before you go for a procedure or surgery, because trauma caused by the surgery or procedure, you don't want to bleed excessively. For example, you're trying to get a dental extraction. You definitely need to stop these blood thinning medicines. As a cardiologist, I am routinely asked for those patients who are on blood thinners to get clearance from the cardiologist. It is exceedingly important because you don't want to bleed with a tooth extraction. On one hand, we give these blood thinners to prevent blood clot formation in the legs, what is known as DVT or deep venous thrombosis, or to prevent blood clot formation in the heart, especially after we put a stent, so that there's no clot formation in a stent, because stent is a foreign body. Anytime there is a foreign body, the body reacts. If you don't give blood thinners, then a blood clot will form inside the stent. So you definitely need to make sure that you never ever stop blood thinners if you have a stent without the advice of your cardiologist. We also give blood thinners such as coumadin to prevent blood clots in the lungs, or to prevent blood clots in the heart chambers that can cause stroke. For coumadin, we have a blood clot measuring test known as the prothrombin time. That is, the blood from a patient is taken and it is made to clot, and the amount of time that is taken by the blood to clot is measured against a normal blood sample, which is already standardized. And your blood thinning should be 2 to 3.5 times that of normal in situations such as blood clots in the heart, or if you had blood clots in the lungs, then you want to make sure, or if you're having a prosthetic heart valve, then you need to monitor your prothrombin time very accurately so that the blood thinning is between 2 and 3.5 times that of the normal blood clotting time. However, when we give medications such as Xeralto or Eliquis, especially for patients with atrial fibrillation or patients who have like stents or patients who have blood clots in the legs, there is no test to measure their effectiveness. We know they are as effective as coumadin because it has been tested in thousands of patients, and the end results have been similar or a little better with these blood thinning agents. As a result, we don't need to measure their blood thinning effect because we know they work. A word of caution: when you are taking blood thinners, there is always a chance that you can bleed internally in the guts, or you can bleed in the brain. So those are the two most dreaded things that we need to be concerned about, and that's why if you are on blood thinners, you need to be very, very regularly followed by your specialist, cardiologist, lung specialist, or neurologist, to make sure the amount of blood thinner you get is just adequate enough to prevent blood clot formation inside the body, such as heart or brain, and at the same time it is thin enough so it doesn't cause bleeding problems. So the blood thinners have to delicately balance the amount of clot formation when it is needed outside the body or inside the body, if there is a tendency to bleed, and at the same time prevention of blood clot formation in the legs, in the lungs, or in the heart, so that you don't end up with a stroke or a heart attack. So ladies and gentlemen, this is a brief overview of blood thinners, blood clotting, breakdown of blood clots, when we use the blood thinners, what are the risks of using excess blood thinners, and how we closely monitor blood thinners. I hope this has been educational to you. If you would like to learn more about other cardiology topics, please leave your comments below, and please do subscribe to our YouTube channel, and we also have a Facebook page which is NNN Media, and please do like our Facebook page. Please do subscribe to our YouTube channel below here. You are watching NNN Media. I am Dr. NIK NIKAM, and we will see you next time. Thank you so much.